Welcome everyone. Hello. Welcome to today's webinar. Today's webinar, as you can see on your screens, is titled as Citizen Science to Global Insights. And we'll be highlighting citizen-led water quality monitoring initiatives today. I'm Rashika from INREM Foundation, and today's webinar is a joint initiative by AKVO, Pavitra Ganga, and INREM Foundation. Welcome again. Really glad to have all of you here. And this is going to be an interactive session. So keep those chat boxes active, keep typing your thoughts, keep sharing your questions in the chat box. Next slide, please. So before we go ahead, there are some guidelines, some housekeeping announcements for all the participants here. As we will be hearing from our speakers, I request all of you to kindly keep your microphones on mute. Please feel free to share your thoughts on the chat box. Apart from that, in case you logged in from a different account, you could change your account name to your real name so that we're able to see you and we're able to know that you're present here. And we're sure that there might be questions and thoughts coming to your mind throughout the presentation. So please feel free to use the chat box, type in your questions. We would like to take questions for each of the speakers here. So please mention the speaker that you would like to direct your question to. Apart from that, if there are any thoughts that you'd like to share, any of your initiatives that you'd like to share, we would also like to hear that, read about that in the chat box. And towards the end of the session, we'll also be opening up the session to all the participants so that we're also able to have a conversation. Next slide, please. So, as I had mentioned earlier, today's webinar is titled From Citizen Science to Global Insights, and we'll be highlighting citizen-led water quality monitoring initiatives. Citizen science is broadly seen as the citizens and communities coming together, contributing essential, useful information for a shared interest towards a shared initiative. And this approach helps in capturing unique experiences through a greater public engagement. Beyond that, citizen science also helps in nudging actions, collective action, and collective generation of efforts towards complex problems such as water contamination. Today's webinar is focused on water quality and issues of water contamination. And we've got highly experienced speakers here who will be talking about different aspects of water. We will be hearing about drinking water, wastewater, as well as data, the role of data in water quality monitoring and water quality initiatives. We all know that water quality in itself is a very vast subject, and any complex subjects such as water quality needs a collective action, needs a network to be coming together and working towards it. I would now like to welcome our speakers for today. We've got Frankie Lee from AKVO, who's the wash specialist at AKVO. We've also got Dr. Paul Campling. He will be representing Pavitra Ganga today, and he's the International Business Development Manager from VITO. And we've got Dr. Sundarajan Krishnan from INREM Foundation, Executive Director from INREM Foundation, who comes with his experience in the field of drinking water, and he'll be sharing community-led initiatives that he's been leading there. Next slide, please. So today's session broadly looks something like this. We've already gone through the introduction, and we would now be heading to know about the Pavitra Ganga project, and we'll be listening from Dr. Paul Campling about it. After that, we'll be listening from Dr. Sundarajan Krishnan on community-based water quality monitoring initiatives. And after that, we've got Mr. Frankie Lee from AKVO talking about the data initiatives at AKVO and how citizens connect with data and tech in water quality initiatives. And then after that, as I mentioned earlier, we'll be opening up the floor for any questions that you may have while we hear from these speakers, from our speakers today, please also keep sharing your questions in the chat box so that we could direct those questions to our speakers. And next slide, please. So before I hand it over to Dr. Paul Campling, I'd like to introduce the Pavitra Ganga project. And Pavitra Ganga is a collaborative project bringing together 14 partners across Europe and India, and it comprises of academic institutions, university, wastewater technology providers, and research institutions. And Dr. Paul will be sharing further about this initiative that has been ongoing for the last 5 years. Over to you, Dr. Paul, and welcome to today's session.
Okay, thanks very much, Rashika. I hope you can all hear me. Yes, I'm really delighted to be part of this webinar. The webinar is part of the capacity building activities of Pavitra Ganga. So it's obvious that I should give an overview of what we're doing in other activities. So yeah, thanks very much. I want to really present this project briefly. I will not go into details. I hope if you're interested, you'll look further into the information on our website. But it is an important project which is funded by both the European Union and the government of India, because they really realize that water is an extremely important issue in Europe and in India and other parts of the world. So it's a collaborative project, as Rishika says, that brings like-minded scientists, engineers, and water practitioners together to really look at where we can unlock the advantages of treating wastewater. We want to move away from wastewater being seen as a burden to society, but we see it as an opportunity to actually reuse the water, treated wastewater, and also to take out of the waste some of the properties which are really beneficial for us, such as bioenergy and using waste for fertilizers. So the project started in February 2019 and ends this month, and we'll be having a final conference next week, which I'll give you some information about further in the presentations. But please go to the next slide. So the goal of Pavitra Ganga is to help society reach the clean water and sanitation goals for all by 2030. And we do this from a slightly different angle. We want to make sure that we properly deal with wastewater, because every society, every community has wastewater. So we want to contribute to clean water and sanitation by actually reducing the pollution of water resources from wastewater, so that our drinking water is secure. And also, as we don't want to use valuable drinking water for irrigation, so we want to actually use the wastewater instead for irrigation rather than using our valuable water resources. So basically, our approach is to promote the circular economy and treat wastewater as a resource and a source of revenue rather than a burden or a cost to society. And we have set out our project along 3 different research and innovation themes. So wastewater treatment and resource recovery is one of the domains. So we're looking at technologies to improve treatment, look at low cost and sustainable systems which will improve our efficiency of treatment, and then also to, as I said before, to take out some of the interesting properties of waste, like biogas and fertilizer. And then on the other hand, we want to look at smart water management. So we're looking at improved methods to collect data, to monitor water quality in the environment, and to really use this information effectively. And also within the smart water management, we're looking at modeling techniques to forecast how we could plan our interventions in this sector more effectively. And then the third domain is water governance, which is looking really at the socioeconomic aspects of wastewater treatment and reuse. Next slide, please. So as Rashika says, we are a diverse consortium of partners across EU and India. We have education and research sector fully represented. We also have innovative SMEs working within the project to bring their technologies to the market. We also are working with a water utility, which is treating water. And then we also have an industry partner as well. It's underpinned, of course, by very excellent institutes like the IIT Delhi and IIT Kanpur, so we're very happy to work with them. And it's a really multidisciplinary approach, which we see as very important to look at really all aspects of wastewater treatment and reuse. Go to the next slide, please. So the two case urban areas that we are working in are very different and very interesting to look at some of the problems in India. So in New Delhi, we're working on the Barapula drain, which of course is a drain originally used to take off the excess rainfall during the monsoon period. But because of intensive urbanization, there are also waste streams entering into this open drain, going through the urban area of New Delhi and flowing into the Yamuna. And this is causing a lot of problems in the quality of the water in that open drain. So it's basically at sometimes really an open sewage. And so we're looking at technologies to deal with this diluted wastewater. And then the second case area is the Kanpur case, which is we're working with technologies to improve the treatment for the urban sewage treatment plant. But of course, in Kanpur, this is at the Jajmal treatment plant. So this is a very difficult situation for the urban wastewater treatment plant because close by there are many, a large cluster of tannery companies which are processing cattle hide to produce leather, and these are using in their processes some very difficult chemicals which are actually ending up illegally into the sewage network. So this treatment plant has have really great difficulties in dealing with these illegal discharges. And in addition to that, downstream of this treatment plant is an existing irrigation scheme, which uses the treated wastewater for irrigating rice and wheat. So that's the situation of our two case areas. I'll go briefly through, next slide, please. So I will not go explain all the different technologies, but basically we're looking at two levels of technologies. We want to remove the bulk organics and nutrient removal. So we're using improved low cost and low energy technologies here. And we're also at this stage looking to see whether we can use the organic matter in the sewage to actually produce biogas effectively. So those are the two technologies on the left. And then on the right, we have polishing technologies to remove some of the problem compounds that we're finding in the wastewater. As I told you, we have the tannery industry close by to the Jajmal SDP. So we want to effectively remove any of the chromium heavy metals in the wastewater. And we also, in the Barrow Pillar drain, have a lot of issues around hospital waste entering into the drain. So we want to deal with some of the microorganics, such as pharmaceutical residues. So these are the polishing techniques on the right, and on the left are the secondary treatment technologies. If we go to the next slide. And this is where probably the closest connection to the webinar is, because we're looking at different technologies and approaches to deal with water quality monitoring. So on the one hand, you have the classical sensoring network, but also looking at citizen-based science to really look at use handheld devices with smartphones to monitor the water quality. So in the context of this project, we have done it within the irrigation scheme downstream of the wastewater treatment plant in Kanpur. So we're looking at various monitoring technologies, and on the right, we are also looking at different strategies to use modeling techniques to look at scenarios to improve our investments in wastewater treatment, and look at the impact of improving treatment on the environment. So those are the technologies we're using around smart water management. And of course, the third interesting component is the water governance, where we're really looking at engaging with the stakeholders to understand the socioeconomic aspects from these discussions, and some of the modeling tools. We're looking at how to improve policy support and help look at the planning aspects. And one of the important problems as well is the wastewater safety planning. And again, this is where the citizen-based science work comes in, because we're looking to see how villages are impacted by the use of partially treated wastewater for irrigation in their areas. So that is the third important activity. And then if we go to the next slide. As I said, we see citizen science as really being the glue between stakeholder engagement and monitoring, because we can use these easy to use techniques of handheld devices with smartphones to flag up some of the water quality issues in the irrigation scheme, and also to use it as a way of improving dialogue with water users. We've obviously, with wastewater, it's a very difficult matrix to monitor. So we have basically looked at the ambient water quality parameters in the local groundwater. So we're looking at nitrates, pH, and electrical conductivity. But we've also looked at some of the microbial problems around using treated wastewater for irrigation. So taken some E. coli measurements as well in the field. So it's rapid surveys to detect hotspots. This is a feature of this approach. We can trigger sampling for taking lab analyses. We don't pretend that these technologies replace conventional lab analysis, but they are a quick way of sort of flagging up problems in the field. And of course, in that sense, we want to see what the risks are for water use, for drinking, and for irrigation. And last but not least, we see this with the use of smartphones and the internet. We can easily communicate this information on the internet and have connection of information that we collect in the field to the users, and so we've created a dashboard within the project so that end users can easily see what kind of information is being collected in the project. Okay, next slide, please. So finally, this is my final slide. I just want to promote the workshops we're having and the final conference we're having next week. if you're interested to come to these workshops, you can find them on our website. The first workshop is on water management decision support tools, which is the modeling approaches. That will be at Terry at the Habitat Center. This is actually a physical face-to-face, so I think there are no places left for that. But for the final conference, there are certainly places if you're interested to come on 24th of January next week, where you'll see and hear much more about the work that we've been doing within Pavitra Ganga. Thanks very much, and look forward to hearing some responses.
Great. Thank you, Dr. Paul. Thank you for taking us through the work that has been going on for the past 5 years and sharing it with the members that have joined us today. I would encourage all the participants here, in case you have any questions, any thoughts on Dr. Paul's presentation, please share your thoughts on the chat box here. I have also just now shared the link to the Pavitra Ganga website, and in case you're interested in signing up for the conference that Dr. Paul just shared about, please go ahead and do so. Please take your time, put in your thoughts in the chat box, and we will be taking up these questions towards the end of the session today. Again, thank you, Dr. Paul. Thank you for your presentation. Now we'll be heading to our next speaker for the day. We have Dr. Sundarajan Krishnan joining us from INREM Foundation. Hello, welcome, Dr. Sundar. And Dr. Sundar is the Executive Director at INREM Foundation. INREM Foundation works towards the mission of safe water communities and focuses on rural communities in India, and INREM Foundation also focuses on water quality and its effect on health, and the focus has been on drinking water. At the same time, we've been acknowledging that the effects of water quality are much vaster and broader. I would now hand over the session to Dr. Sundar. Over to you.
Thank you, Rashika, and it's nice to be part of this webinar, and along with the other organizations, AKVO and Pavitra Ganga as a program, and a lot to learn from what is being shared here, and I think a lot of cross exchange will definitely happen because of this webinar. I think Rashika has already introduced about our organization as we work on across India in rural areas, especially in areas which are highly affected with problems of water quality, and broadly work towards what we call as water safe communities in terms of community-led programs where water safety is looked at every point, right from drinking water to irrigation to water bodies, as a whole. And at the core of our programs, we definitely have people at the center, and for the purpose of involvement, participation, and also sustainability. Community-based water quality monitoring is essential, and we feel that that is at the core and the foundation of all that we do in INREM. Next slide, please. So in this presentation, I'll be talking very briefly about the problem. I think most of the participants here would know about the larger problem of why working on these issues is important. But I'll focus more on what we are learning from our experiences across India. We work in 7 states in India, in roughly 9 districts, where we work closely with communities that are affected with problems such as fluoride contamination, arsenic contamination, nitrate contamination, affected with flood-related problems, and variety of other water safety and water quality problems. So I'll be talking about what we are learning from these different initiatives across India, the process that we follow, and also the experiences that we are learning. But apart from that, we'll also bring in how there is cross-learning between organizations as a network within India to try and see how these community-led initiatives can talk with each other and work towards a larger purpose. For example, as I think one of the participants has rightly said here, there is this large program such as Jal Jeevan Mission happening, within which such community-led initiatives are extremely important. And initiatives such as this also add on. Next slide and beyond. I think you can go to the next one also. As I said, there is less to be said on this because we know that water contamination and water-led problems and water-related problems lie at the center of a lot of public health problems as a whole, especially of the poor and people who are having poorer access to nutrition, to better food, and to health access as a whole. Our estimates from public water databases of problems such as biological contamination, diarrheal-based diseases, chemical contamination problems, and other related vector-borne diseases as a whole tells us that roughly more than 100 million and close to 150 million people are affected with water-related diseases in India. So that's a huge proportion of the rural population and also the population of India as well. As you know, India has large sections of population which are dependent still on untreated water, though it's changing fast with newer water supply programs, and therefore this is a serious problem. Recent estimates tell us that the cost of the problem is also very high. I won't go into exactly these numbers because these are all different estimates, but we understand that the health cost of these problems are extremely high. It's high time that community-led interventions scale up and become part of, get absorbed into larger initiatives, because that's the only way that we'll have sustainability of these programs. Next slide, please. You would all know about these issues of that are present across India and the devastating health impacts that they cause across generations. Many of these problems are intergenerational problems. Some of these are chronic problems, for example, regional hotspots of cancer. Some of these are irreversible problems, for example, disabilities and various other problems that you get from a variety of contamination that is often present in water. And for this, community-led water quality monitoring needs to be at the core, because if people do not identify the reason for what they are suffering with the water that they are connected with, normally we just are able to see, sense water by actually seeing it, smelling it, or tasting it. But we need to go beyond it in terms of having monitoring processes within the community that actually help in being able to detect these problems and have processes that help over the long term. And that's what I'll be talking about in terms of the process and also the experiences from different locations that I work. Next slide. So there's a 5-step kind of a learning that we have from programs. It starts with identifying individuals whom we call as water quality champions within communities. And it could be anybody within the community who can be the champion for your programs, for your community-led programs. It's very important to look at their motivations, look at where they are coming from, what is it that motivates them into being part of such programs, and then looking at skilling and building capacities for these efforts. And that is essential in terms of the second step that I'm talking about here. I'll just briefly mention about few of the steps that we follow in our work. Demonstrating solutions is critical in terms of not just talking about community-led monitoring, but also looking at solutions that are helping people along with the champions that I mentioned in step 1. And it's very important for these efforts to be integrated within wider efforts in terms of government programs or NGO programs or larger research programs, but it to be embedded within larger efforts is very critical so that there is sustainability over the long term. And the step number 5 I'll talk about is cross linkages and sharing for collaboration between different groups. Next slide, please. Next slide. The first step that I talk about is identifying the champion. And here, over the years in India, we started out with working closely with health workers around 5 to 10 years back, and we realized that our hunch and our hypothesis was that health workers on ground are the best, are placed best to communicate with people on water issues, especially water contamination issues. in terms of even facilitating community-led monitoring. But over the time, we realized that there are a variety of community service providers and citizen volunteers within the community who can be leveraged upon and who actually come forward in different places. And there is a whole diversity of these individuals that are present contextually in different places. So what we have learned is that we open to such different types of individuals, whether they are already embedded within systems as a service provider, or they are part of citizen groups or individual citizens, and understanding their backgrounds and roles and functions to then come forward with what really motivates them to be a water champion. Next slide. So there is a whole variety, of different types of water service providers, or for example, in Karnataka, they called as Jalagara or watermen. We work closely with the Jalagara water provider. The second picture is from Rajasthan, Dungarpur, where it's the Asha health worker. And the third picture is from MP, where you have citizens who are part of village water sanitation committees, who are part of this community-led water monitoring process. So identifying who individually and which set of people who are there with you as champions, water quality champions, is very important as step one. Next slide, please. So the step two is as I shared, to build their capacity. And here, what we have learned is that having a very basic background on water issues, on water quality issues, which are helping to demystify the local problems. As part of this, also learning about testing of water with very simple tools such as water testing kits, but also getting a wide view by connecting what are the water standards. So for example, if you take India, you have something called Bureau of Indian Standards, which are very similar to the WHO standards group. So actually knowing about the water standards, what is the standard for nitrate? What is the water standard for pathogens? What are the testing processes, and how do you really connect a high fluoride in water to your health? These are very essential and important, and there are a variety of communication materials and a variety of demystification tools that we use for capacity building. So, for example, over here, Jalagara water in Chikbalapur is a district in Karnataka, in the southern part of India, where a mix of these tools have been used for the last few years, and we'll talk more about it as we next slide, please. So as you see, there are a variety of tools available, and especially in the Indian context, these are in different languages. I guess around 8 or 10 languages, and it's open source, and we collaborate on this for people to use it and build their own education and communication materials. So to get in touch with us, and we'll share it with all of you. We call it Safe Water Learning Cards, and we'll be happy to work together with all of you to collaborate and scale it up. Next slide. So the next step as part of this process that I wish to share about is demonstration of solutions in terms of community-based water quality monitoring, having very clear action points in terms of what is the process, what are you going to test, how are you going to test. For example, if it is field testing kits, FTKs, where are you going to get FTKs? Who is going to provide it? Is it going to be accessed or taken by, let us say, the Gram Panchayat? Then what is the expiry date? Who will use this water testing kit? These specifics are really very important. And then how are you going to communicate it within the village? Are you going to put it up on a wall? How frequently? Who is going to update it? And how does it integrate, into part of the village planning process and village, development process? Next slide. So in terms of this broader solution as a package, for example, in Karnataka with Jalagaras and Chikbalapur, there is a digital platform that we have used across these 290 villages, where community resource persons, CRPs, were trained with the partner organizations, Foundation for Ecological Security, FES, and this partner organizations further scaled it up and then using it in village development plans. So the solution, when it becomes visible to people, the community-based water quality monitoring is possible to sustain in terms of actually being part of planning and development processes within the village. Next slide. The fourth point that I want to talk about is integration in terms of such community-based water quality monitoring not being standalone, but integrated within existing monitoring systems. It could be government programs, non-government programs, and it's important for us to look at opportunities where such integration is possible. Next slide. Nalgonda is a place in Telangana where fluoride has been a problem for the last probably 80-90 years. And there, our focus has been on water champions with Anganwadi members. Anganwadis are nutrition service providers. As I said, service providers within villages are very important. And nutrition service providers for small children and pregnant women, where even water and basic nutritious food provision is made. And there, 200 members, 200 Anganwadi workers across the village have been part of a widespread community-based water quality monitoring program that we have facilitated. And there is an integrated approach in terms of water testing kits being available from the water supply department. The Anganwadis are members of the nutrition department, and then monitoring efforts are being taken up by the government. The data enters into the government system, and so it is available for everybody out there. Such integration is very important for long-term sustainability. Otherwise, such efforts remain as great pilot efforts which don't scale. So at the outset, thinking about integrating it into existing large-scale programs is very important, and designing it so that it will actually scale. Next point. And the last important point is that such initiatives need to actually collaborate and learn and share with each other. I mean, as I said, the half-life or the point at which such initiatives go down is very fast. I mean, sometimes even less than 6 months. It always is a great start, but then what happens after 6 months? What happens after the first kids run off? What happens after a year or two? Those are the very crucial points. And for us to be enabling organizations to be available, supporting the system, supporting village institutions and these water champions, and across different organizations across India. So there are other organizations. Next slide, for example, WaterAid is something that we talk about here. Great work by WaterAid in Madhya Pradesh, where we are learning from them, where they're working with women in 5 districts on community-based water quality monitoring, but also other organizations, Make Pine Abhiyan from Jharkhand, Water for People from West Bengal, and many such fascinating efforts at community-based water quality monitoring happening across India. And as a network, as a water quality network, all of us collaborate with each other and try to learn from each other in terms of these processes and what helps to have more participation and sustain it over the long term. Next slide. And towards the end, last conclusion. So just learning from all these 5 efforts, the 5 processes that I've put forward here in terms of identifying the champion to identify a champion or a set of water champions in the villages, to integrating it within systems, and finally also collaborating and sharing it across different initiatives. That's the wider set of efforts that we have been doing in interim, and we come here with an open mind in terms of putting things forward and collaborating and learning from all of you here to also, for example, something that I learned today is about wastewater and wastewater monitoring, which we want to really take back to the communities that we work with. So I look forward to a lot of collaboration with everybody. Thank you so much.
Thank you, Dr. Sundar. Thank you for taking us through the community-based water quality monitoring systems and the initiatives in different regions in India. I again encourage the participants here to please share your thoughts, and I see that many of you here have already been doing that. In case you have any questions specifically for Dr. Sundarajan Krishnan and Dr. Paul Campling, please go ahead and share it in the chat box. We'll be taking it up towards the end of the session today. Now we have Mr. Frankie Lee from AKVO. And before we listen from Frankie, I would like to introduce AKVO. AKVO is a non-profit organization working to bring data and digitalization into the forefront. And AKVO has been focusing on water, agriculture, and climate. Today, Frankie would be sharing the global initiatives where digital tools have enabled citizens' engagement. AKVO has also been a partner in the Pavitra Ganga initiative. And over to you, Frankie. Looking forward to hearing from you.
Great, thank you. Just check, is my microphone and also video working?
Yes. Yes.
Okay, great. Thank you. So just a few more words on AKVO before we dive into the data and tech, because I think it provides a nice context into it. What are we about? We are about developing data and digital tools that help to turn data into actionable insights to be used for decision making, and ultimately to improve impact and to improve wellness for all people. So the three areas of AKVO, first of all, data and tech. We are comprised of software specialists and also data specialists that are involved in building these tools. In addition, we have sector expertise, such as myself. I'm a water specialist. In addition, we have people that are involved in agriculture, climate, and so we have the sector specialists to help to provide context when developing data and tech, and also in terms of communicating and linking with the partners. Lastly, in terms of presence, we're spread out throughout the world. I myself am based in the Netherlands, but besides that, we have staff in the Americas, in Africa, and also in Asia. Just one other word, we have greatly appreciated our collaboration in Pavitra Ganga, especially in the area of citizen science. As Dr. Kampling mentioned, it is the glue that brings together engagement and also monitoring. And we appreciate Pavitra Ganga's emphasis on that. In addition, working with Inman Foundation that does the actual work on the ground, working in water quality testing. It's only working with organizations like INRAM that allow AKVO to know how to design the appropriate data and tech. So next slide. So we're happy to be involved in the area of citizen science. And for this portion of the presentation, we'll be talking about three areas in which data and tech is supporting citizen science. The first area would be involved in helping citizens with data collection. The second one will be helping in terms of improving communication with citizens to be able to allow citizens to provide feedback and also in connecting citizens together. So that's the second area. In the third area, it's almost like the reverse. It's how to tap into the expertise, the input of citizens to help develop information products and tech solutions. Okay, thank you. So as an example of data collection, here one of our projects in Guyana related to artisanal mining. It's been going on there for many decades. That has caused a lot of impact to the communities, to the environment. In recent years, it has escalated in terms of the approval of larger scale mines. And with that, there's been a greater emphasis on wanting to involve the communities, the citizens, in helping monitoring the impacts. And so this is kind of a perfect example of how citizen engagement is, citizen science is critical. And also this relates to the work that we have been involved in with Pavitra Ganga in that specifically deals with water quality. Next slide. I like this image because it helps to show that water quality testing is not that simple. It requires technical expertise. In fact, where I'm from in Canada, in order to do water quality testing, you have to be certified and go through quite a rigorous training process. And so that's one of the challenges. We want the citizens to be involved in doing the testing, in seeing the results for themselves. But at the same time, it's not a very straightforward in terms of doing the actual tests. And also there's a wide spectrum in terms of the background of the citizens in their abilities. And so that's one of the challenges. In addition, once you get the results, they're not, oftentimes they're not that easy to understand. And so in the work that we have been involved in, we wanted to try to help to overcome some of these barriers to help in data collection. Next slide. And so here on the left, you see a very typical water quality testing meter. And on the right is essentially a mobile app. And how can a software product support in water quality testing? We'll kind of go into that in a little bit of detail. So next slide. Essentially, what we've got involved in is related to within the realm of UX. So of course, the software app, the mobile app, it can be simply used as data entry, right? So we want to go paperless instead of writing down and run the risk of transcription errors. You go paperless, and that helps from one perspective. But we felt that you can actually go further. And so what we've done is we've modified the UX so that when the tester goes and each time they collect a water sample and test it, they can see the instructions every time within the app. So that's one. Secondly, as the instructions are coming out, slide frame by frame, we also allow time for the tester to do different steps, such as adding the reagents, such as taking a reading, and that's important because in many cases that's an important part of getting proper results. We don't want them to go to the next step before waiting for the reagents to do their effect. And so by doing that, what we're essentially doing is helping for the actual procedure to be done correctly and for improving the results from the water quality testing. It's quite simple, but at the same time, we have found it to be useful in helping to have good quality results. Next slide. And so after doing the testing, getting the results, what they would see is a bunch of numbers. And oftentimes it may not mean that much to them. And so another service that we provided is automated visualizations. And so with the results, as you can see, if you see individual numbers, it's much different than if you see it on a map in the right. It shows the locations of where the water quality is fine. It also shows the locations in red where there are exceedances. And by this, we feel that we have contributed in narrowing the gap in terms of giving the citizens access to water quality tech. Next slide. Okay, so in this next area, there are, I'll be sharing about 2 classes of tools that are part of this. In the first one, it's related to this image in the sense that it's related to getting information or getting feedback from the citizens. But what might be a little bit confusing is that what this image shows is a newer kind of way that a newer way which is not represented. Okay, and so essentially one of the areas that we've been involved in is in crowdsourcing, and with crowdsourcing, it's being able to collect information from the citizens at their own time, and also it does not require the data collectors to be there. And so here it's a very traditional way where you have the data collector there going into the market, trying to get information from one of the market sellers. But what the limitations of this is that it's very time specific. And so what about the market sellers that are not there this particular day, right? Also, oh, sorry, back to the previous slide. And also in terms of the data collector, that person may not have the time or the resources to be able to cover the entire market. And so in terms of the concept of crowdsourcing, that has been becoming more and more popular. And I'm representing that with that QR code on the bottom. So instead of sending a data collector into the market, what we would do is we would use media to broadcast messages to the population, encouraging them to submit their feedback at their own time and at their own will. Besides media, broadcast media, we will also put posters up, and the posters would have a QR code, and they can provide feedback whenever they want. And also that it lowers the barrier for that. Okay, next slide. Okay, and so in summary, it overcomes the challenges in the sense that oftentimes citizens, they lack feedback pathways. And secondly, they may be too busy to answer at particular times. Okay, next slide. So the communication platforms that we've been involved in is through USSD. So many of you have probably heard of SMS texting, right? But USSD, it's a format of communication with your mobile phone, oftentimes used as an emergency alert. Or what you're probably more familiar with, the USSD technology is oftentimes used in recharging your credit in the sense that it's a separate channel, it's free, and this lowers the barrier of the costs involved that may be limiting user participation. In addition to that, we also can use WhatsApp and of course SMS. Next slide. And so with this type of technology, we had participated in the COVID-related project and wanted to see how it impacted food security in Zambia. And so we used the method of broadcasting over the radio. And it would be simply broadcasting the USSD code. So they would have, it's a very short code that would be shared. And then it'd be asking for feedback from citizens. And from that, as you can see, we got some quite interesting results from it. Next slide. So the second class is in addition to just getting information from the citizen, there's technology that you can do to allow for two-way communication. And so this AgriConnect product we're just in development right now. And the purpose of it is to assist smallholder farmers. One way in which it assists them is that for those that subscribe by simply joining the WhatsApp group, then they can get alerts that's related to their needs. For example, it could be alerts related to extreme events for climate. It can be alerts in terms of the availability of water sources that's close to the location. And so the way that we're doing it is that we would pre-process satellite data, and so that it's suitable for specifically where the smallholder farmer is, and then for those that subscribe, we would send the alert to them when relevant. The second way in which the app works is that it allows the farmer to ask questions. And so if there is some sort of agri-related questions, then they would just simply post it on the WhatsApp. And they could be answered by the implementing partner that's hosting this platform, or it can be answered by other smallholder farmers. And so this is something that's an exciting like it's initiative that we're just getting into, and that we look forward to reporting more about it in the future. So next slide. And so in this third area, it's using gamification to allow citizens to contribute to essentially making maps. So let's go to the next one. And so what is the challenge? So the challenge is that for situations of planning land use, for disaster response, water resource planning, to have maps that are of sufficient quality for those purposes, it's not easy. It's not simply just pulling satellite imagery and that's it. There's a lot of processing that's involved and a lot of work in putting the maps together. And so we've involved in a very nice initiative that makes it easier for citizens to help in developing maps for their own area. So let's go to the next slide. And so the process goes like this. Essentially, the mapping tool is a game. And so the tool is set up in terms of beforehand, it's already loaded with satellite imagery. It's already been decided in which are the work areas. After that's all ready to go, then it's loaded up as a possible game in which anyone can get involved in. And so anyone that decides to play the game, then it would be presented with essentially the raw map and with kind of a fun interface for them to start to like identify, where the wells are, which areas are urban areas, which of the areas are the rural areas. And so that's the key layer there. Yeah. In addition to that, there will be a ground truthing element to it, where that's something that AKVO has been involved in, where to confirm all the work that's been done with the game, there's a ground truthing element. And then after all that is done, then the final map is put together. So next slide. So this, you can see a little bit in terms of the process of putting together the background for the game, setting it up, identifying the areas, loading up some of the background data. Next slide. And then here you kind of see a visual of the actual game itself. It's kind of like the World of Warcraft type of feel to it, as you can see. Next one. And so here you see the final product, in which you come up at the end of the day a very traditional map, and the key part of it is that the information is reliable. What is the difference between this and simply using machine learning? With machine learning, it's very visual based, and so when you look at the satellite imagery, based on a visual algorithm, it decides on how to categorize a certain area. When you make it a game and involve the citizens, then you allow that layer of the local context and local understanding, which helps to which leads to a more accurate result. And so that's why this has been a quite exciting initiative for us. So next slide. So in summary, there's quite a lot of areas in which data and digital tools have been part of supporting citizen science in collecting, understanding good quality data, and providing a forum for citizens to be heard, and finally providing a platform for citizens to produce information products. So if there's any further questions related to these digital and data tools, please feel free to get in touch, and I'd be happy to share more. Thank you.
Great, thank you, Frankie, for sharing your presentation and sharing the various initiatives that AKVO has been undertaking in different areas globally. We are now going to be opening up the session for questions, and I see that there have been many questions in the chat box as well. Thank you everyone for engaging with today's webinar, sharing your thoughts, sharing your questions. So I would go ahead and take up some questions one by one, and few of them are directed to our speakers today and few of them are open. So for the open questions, I would request our speakers to kindly take it up and respond to those questions. The first question is from Ekansha, who's asking about the exit strategy and how such a strategy could help in ensuring sustainability and keeping the same momentum after an initiative is completed or an exit takes place. I see that Dr. Sundar has already responded to this question in the chat box. Would you like to elaborate more on your response and share what these district water quality platforms look like and any other initiatives? Over to you.
Sure, Rashika. Yes, Kansha, I think very important point that you put forward that, I mean, as enabling organizations, we cannot be there forever, right? We cannot be present close to the community and enabling community-based monitoring forever. So there is a exit process that definitely takes place. But what we have seen as an organization is that it's a very long-term process, especially when we are working with all these complex issues. You need engagement over the long term. So I won't like to put forward a view that, I mean, you just get in for 6 months and out and then it will stay forever. It doesn't happen like that. So there is engagement needed for the long term. But then what sort of engagement, is needed for the long term? So something that we do is in areas that we work, that is districts that we work, where villages where we have been working for a long time. We constantly engage at the district level onto what we call a district water quality platform. So district water quality platform is an open platform which works very closely with the government. That is, it has different government programs and departments coming together from water, from health, from education, from nutrition. But along with that, there is space for community-based organizations, for peoples, for citizen groups to participate in it. And by helping to sustain this district water quality platform for the long term, what we have been able to do is keep the attention alive on the community-based initiatives for the long term, keep leveraging on different opportunities. For example, we have seen that there are different waves of interest that go on over years. Sometimes there is a program from the water department, the water supply program. Sometimes there is a program from the health side, some NGO comes up, some corporate entity comes up over time. So by keeping this platform open for the long term and keeping it open and collaborative, you keep the interest alive over the long term. Definitely there will be lows and highs, but then, yeah, I mean, to find a way that the interest and the support also remains alive over the long term. So that's what we do as an organization. We'll be happy to share about what we really mean by these district platforms.
Thank you, Dr. Sundar. Rashika, can I ask a very quick follow-up question?
Yeah, sure.
Thank you. I'll keep it very short. So I have actually 2 follow-up questions to this. One is that when you say you have a platform like that, do you have a buy-in from the government? Does it have government representation, or is it already a part of the governance? Is it already part of the institutional structure? Because then that changes how the legitimacy of it is viewed. That's one. And second is, when you say that you're choosing your champions, so based on my experience of working in field, and I was a part of evaluating Atal Bhujal Yojana, which is a very similar citizen science-based thing that Government of India is trying to do. It's usually very difficult to convince frontline workers to do additional work because they view this as an additional work. So to ensure that they constantly do this, did you build in some kind of monetary incentives or some other kind of incentives, or you did not encounter such resistance itself? So yeah, those are two questions. Thank you.
Basic answer. So the first question, yes, I think so. We feel that it is very important over the long term to have legitimacy uh, to these institutions that we have for collaboration at the district level for the district platforms. And what we do is we keep it open in terms of diversity of how these institutions are approached. So I'll give you two examples. So for example, in Odisha, where we work in a district called Balasore, the district water quality platform is embedded within the district institutional setup in terms of the district deputy collector to the Gram Panchayat, firming it up with uh, as a coordinating institution of the district, hierarchically from the district collector and the deputy collector over to the panchayat, and thereby it surpasses any particular specific programs that you might have in that particular district. Whereas in Rajasthan, where we work, uh, what has happened and explored towards is to keep the health department at the center and to bring all different institutions together along with it. So yes, to your first question, that while designing these collaborative platforms, what we have learned is that you need to definitely bring the legitimacy to it and the governance aspect in terms of a long term, but then it will not be the same in every state and not will be the same in every location where we go. Secondly, yes, very much. If you take Atal Bhujal program or if you take the Jal Jeevan Mission program, when community-led initiatives are being catalyzed and supported, the question of whether there is an incentive, for the frontline worker or the community resource person or the citizen volunteer on ground is a very serious one, and it's a very important one because there can be a one-time participation, a one-time training, but it won't sustain over the long term. And we have seen that resistance on ground, and we have seen those issues, come up. Having said that, there are great examples also that we are seeing in terms of trying to overcome this resistance. So, for example, in Madhya Pradesh, um, there's a collective of different efforts which finally came together to bring community health officers, CHOs, to have a mandate on community-based water quality project. That is to be the entity, be the individual who is there on ground to stimulate community-based water monitoring. And it's part of the incentive structure, the salary structure, and the mandate of CHOs over there. And that's why they actually, it's wired into their daily effort at PHCs in Madhya Pradesh, and it's being scaled up across the state now. So yes and no. I mean, I would maybe it will be good for a direct interaction to share more examples on this. But we feel that it is actually possible to bring it into the mandate of particular community service providers across departments and make it possible for them to participate it willingly.
Thanks, Akansha, and thanks, Dr. Sundar. Actually, there's a related question in the chat box, and we will come back to it. I will now go ahead and take up the next question. There are a few questions for Frankie here, and the first question is that how do we see the application of electrochemical sensors in the water quality monitoring? Anil Daya from India, I assume, is asking this question. Over to you, Frankie. So the question, I repeat, is how do we see the application of electrochemical sensors in water quality monitoring?
A very interesting question. It sounds like a question very specifically to water quality, to how can I say, the application of water quality testing and characterizing the water, right? And it's not as directly related to the actual data collection layer, right? But if I can, I think it's better for Sundar to reply to that. But I can give a first reply in the sense that it helps to give a general picture of the amount of elements that are in the water as opposed to the specific parameter. And so in terms of the electronic probes, they're great for that. And so I think that's the area that you're thinking of asking. I just want to confirm.
Sure, frankly, I can just add a bit to it, the sense that
please.
Yes, there are a lot of sensors which have been coming up over the last 10 to 12 years, and at a testing or piloting stage, and also in the market, especially in the Indian context. But when we see, the real need for these sensors, because on one hand, you have field testing kits, what we call as FTKs in India. But the good and bad of it is that they are visual, they're easy to use, but then they suffer from reliability and also accuracy issues. On the other hand, but they are low cost, and right now it is possible to make them widely available. On the other hand, you have to test, the option is that you actually go to a certified laboratory and test your water, taking samples there, and expensive, the cost of these testing, it's all expensive. So somewhere in this middle space, there is definitely a space for sensors, whether electrochemical or biosensors, and there is a whole huge space where these are active. And right now in India, I mean, for example, just right now, state of Haryana is actually scaled up one such sensor. I won't name the name of the company, but then it is actually scaled up in the state of Haryana with Jal Jeevan Mission. So as we are speaking, some of these sensors are actually active and scaling up. However, if you look at the current cost, maybe it's because of the scale at which they work right now, the scale of production and what is really available in the market. If you look at the current costing, it doesn't seem to be attractive enough to actually forego either of these options, that is FTKs or labs. Right now, I would either go for an FTK with the community field testing kit, or I would go for a certified lab if I want to get it tested at the lab. I will not go for the sensor because it doesn't sound attractive to me at this point. But I think it is just 2 or 3 years down the line that these sensors would become even attractive on either of these sites. Even because in India we are actually talking about block level laboratories and field laboratories being equipped with such sensors. I mean, we are actually making it possible in the policy to do
that. Thank you for the clarification there. I think there's also the aspect of the Internet of Things. And so a layer on top of these sensors is being able to transfer that information remotely to a central location. That's one of the really attractive aspects of using these types of stationary sensors. So kind of how we refer to them. And so yeah, there is quite an explosion of this technology, and I think down the road, as Sundar said, they'll be more accepted.
Great, thanks, Frankie. Thanks, Dr. Sundar. The next question again to you, Frankie. This is from Nicholas Dickinson, who's asking about the QR code in the presentation somewhere, and he was asking whether or not it's a live site or a testing site. I would also invite Nicholas, in case you'd like to elaborate your question, please feel free to unmute yourself and elaborate. And then Frankie could go ahead and respond to your question.
No, I mean, it's just to understand whether we can use that QR code or not.
Got it.
Yes, thank you. So I was kind of aware that potential risk that someone would actually scan the code. So I made sure I used one that actually worked and not going to some just random place. But don't worry, it's a testing site. You can go through the form, try it out. It doesn't go into a production dashboard. This is a testing dashboard that we have that we've developed. So yeah, feel free.
Great, thanks, Frankie. The next question is more open than specific and direct. Mr. Masood Ahmed is asking what could be the possible treatment for ammonia and arsenic contaminated water at a commercial level. So I open this question up to Dr. Paul, Frankie, Dr. Sundar, or any one of you who'd like to go ahead and respond to this question.
Can you repeat the question, Rashika?
Yes, sure. So the question is, what are the treatment technologies, or how could ammonia and arsenic contaminated water be treated at a commercial level, at a larger scale, rather than an individual level?
Well, within our project, we've been looking at structured adsorbents to remove some of the compounds of concern, and we've been testing them on chromium. But I think these adsorbents can be used. This is a polishing technique to actually remove things like arsenic as well. So that's one of the developments going ahead. Because we designed the adsorbents to be specifically taking out targeted compounds, so you could design that if arsenic was a concern, then it could be reassigned to redesigned to take that out of the wastewater.
All right, thank you. Anything to add, Frankie and Dr. Sundar?
No, nothing from my side. It's definitely, I believe, one for Paul.
Right. So the next question again is actually more about what really happens in a network, what really happens when citizens come together, working towards an initiative. And Lisha here is asking, um, uh, what is the incentive for citizens coming together, working towards the initiative, working towards shared initiative? Is there any kind of a compensation that citizens get for their participation or for their contribution? And what are the possibilities that lie here? What kind of collaborations can come out of it? So again, over to you, Frankie, Dr. Sundar, Paul, Dr. Paul, any one of you could take this question up.
I guess I can go first, or yeah, I'll go first. And so in the citizen science initiatives that we've been part of, there hasn't been any compensation. It's purely voluntary, and then of course the big question is, the motivation, and that's kind of the exciting part, because people they participate mainly because they find value in it, right? And so it's different in terms of different experiences that we've been part of. Like, for example, the gold mining one. It's about understanding whether your community is impacted by the mining, and so there's that's the motivation there. In terms of initiatives such as the gamification one, there's a similar effort out there that many of you may have heard of, the OpenStreetMap product. That is something that is also has no compensation. Lots of individuals, they get involved because they just simply want to have better maps for their area, and some people, they do it because they find it a fun hobby. And this hobby is contributing to the greater good, and so that's one thing that we found that's been quite exciting, is that people are doing it, for improving the situation for their communities and also for others.
Yeah, that's very interesting, Frankie. Just so this initiative serving as a hobby for some people, and incentives could be very unique for different people. It need not be similar for all the citizens or for all the people across the network. Again, I think Dr. Sundar, would you like to add here as well?
Yes, Rashika. So we have seen two types of broad strategies over here. One is where it's basically you're activating a mandate. So when we actually talk about Jalagara, watermen in Chikbalapur or Jal Mitra in Assam, they are water operators who are actually paid salaries by the government. And it's part of their mandate to actually work with the community on to demystify water, to actually get the community to test for water. They are paid money. It's, on the other hand, we actually work with the government to ensure that there are fair wages paid for these. We actually do advocacy to talk about fair wages for these people who are on ground, because on one hand, yes, they are paid compensation and wages or salaries for their work, but on the other hand, we don't think that it's fair enough. If you look at similar other such tasks which are performed right in the village, the one strategy is to work with such people, that is community service providers from the water or health or nutrition system. In India, they could be water operators such as Jalagara, Jal Mitra, health workers such as ASHA, nutrition service providers such as Anganwadi, and then to find the particular starting point for them. So, for example, for Anganwadi workers, it is basically ensuring safe water and safe food in her Anganwadi. So, if you actually talk about an Anganwadi in the entire community, it becomes a huge task. So, if you actually map out what you really want that particular community representative to act on for a community citizen science initiative, then if you activate the mandate, that's one strategy that we go. The other whole strategy is that of citizen volunteers, which frankly talk about. So in Assam, in Eastern India, we work with students across Assam, that is high school students across Assam, and activate 8th, 9th, and 11th class students. Right now, we have around 24,000 students across the state who, as part of their education, as part of their curriculum, go through water schools and then take part in citizen science initiatives. So that's the other strategy that we are working on, which in some ways, you got to look at scale with respect to your efforts. That is, what is it that what kind of citizen science initiatives can actually also scale within the system, whether it is a service provider approach or it is a citizen volunteer. So these are two different varied examples that we are working.
Interesting. Thanks, Dr. Sundar. I think we have time for one more question before we end today's webinar. This is again an open question, and it's about what could be a water testing kit that university students could use for their assignments, and what would be the costing of these kits? And then also what are other cost effective and relatively inexpensive water testing kits that university students could use while they're working on their individual assignments. Dr. Paul, would you like to respond to this?
Well, I don't think I'm best placed to respond to that, because in fact we are, within our project we just use what was available on the market, so we don't have an overview of what is cost effective. But I just like to, during this time, to go back a little bit to the questions we had before, because of legitimacy and motivation. It seems to be a very important part of this citizen-based work. And within our research and innovation project, of course, what we tried to do in Pavitra Ganga, and together with AKVO, we worked with a locally based NGO, which was embedded in the community. And that helped us to really engage and get motivation from the local people to test their waters. And I think that's really important, to have that kind of interaction with people who are on the long term based in the community and working with the community to build up trust. Because the nature of the projects that scientists usually work on is usually very fun, government funded based, we move on to other projects, but there is no sort of long-term commitment. So I think it's very important to work with the NGO sector who have a long-term commitment to local environment, so that you think globally and act locally. So that's very important in this kind of activity.
Absolutely, Dr. Paul, thanks. And in case Frankie and Dr. Sundar, would you like to respond to the other question on cost-effective field test kits that people could use?
Yeah, I think Rashika, for the Indian context, I think there's a great summary which is done by India Water Portal. We just type water testing kits in India, you'll get a great summary and comparison of different kits. You can just go in order, or you can get in touch with us. I mean, we'll always point you out to different vendors across India. Reasonable cost between 5,000 to 10,000. You can do anywhere between 7 to 10 or 12 parameters. Some of the parameters are more expensive. So, for example, if you compare like two critical chemical contaminants in India, fluoride and arsenic, fluoride you can test for less than 5 rupees per test, reasonably at a very high quality as an indicative test. But arsenic, it will cost you more than 100 rupees to do a good quality indicative tests, for even with a field testing kit. So that's the level of difference between parameters. So while we just generalize in terms of a field test kit, even between a parameter to the parameter, there is a difference in cost. And you don't want to do an arsenic test everywhere, or you don't want to do a fluoride test everywhere. So you can pick and choose what you really want to test and construct your own field testing kit so that your university can actually save costs. We can help you.
I think my comment on,
yes, please go ahead, Frank.
Sorry, a very quick comment. I think it's difficult in the sense that there's so many options out there, and as Sundar has mentioned, it also depends on the level of precision that you want, that you need for your work. But one thing is that if you go with the larger commercial ones, they tend to be more expensive, and so there's lots of organizations that have developed specialized kits, specifically that are low cost. And I think that, and it's regional. Like in India, you have your organizations that have done that. In Europe, I know of a couple also that have been involved in that. And in fact, these organizations, oftentimes they are linked to a larger organization, such as a pharmaceutical or a big chemical company. And so if you're interested in more info on that, also feel free to get in contact with me.
Great. Thanks, Frankie. And I think after this webinar today, in a couple of days, we'll be sharing resources with all of the participants who joined us. We'll try and incorporate these resources that were mentioned today during the Q&A session. With this, we come to the end of today's webinar. And again, I'd like to thank all our speakers today, Dr. Paul from Pavitra Ganga and Frankie from AKVO and Dr. Sundar from Interim Foundation for taking us through the various initiatives that you've been taking, incorporating citizen science in the work that you've been doing, and how it's crucial for long-term sustainability of the different kind of work that we're doing towards a shared goal, if I may add so. And with this, here on the screen are the details of all three organizations, and in case the participants here who joined us in this webinar today would like to reach out to the organizations, please feel free to do so. We'll also be sharing all the resources with you in a couple of days so that we could keep these conversations going. And thank you for joining us today. Thank you again to all the speakers, and looking forward to continued learning. Hope to see you all again soon. Thanks.